Good evening. My name is Selena Joffrey, and I'm the Director of Business and Policy at Asia Society Texas Center. Thank you for joining us for week 8 of our webcast series on COVID-19, which explores various themes and topics impacting our community. This evening's webcast is on the topic of reopening Houston amid COVID-19. Since the last few weeks, Texas has begun the process of lifting stay-at-home orders in phases, while public health officials emphasize the need to continue social distancing measures and to scale up the production of tests and contact tracing. Tonight's discussion will be on Houston's plans for reopening parts of the economy while taking appropriate measures to safeguard public health. Our speakers for this evening are Marvin Odom, appointed by Houston Mayor Turner as Houston's COVID-19 Relief and Recovery Czar, and Dr. Umair Shah, Executive Director and Local Health Authority for Harris County Public Health. Our moderator is Marty Goosen. He's Vice Chairman of JP Morgan Private Bank and a board member of Asia Society Texas Center. Following the conversation, we'll be taking some questions from viewers, so please share your questions throughout the discussion via the Facebook and YouTube comment box. Thank you.
Thank you, Selena. It's wonderful to be here with you this evening, and I welcome all of our guests one more time. We're proud to be putting on these series of webcasts to help explain COVID-19 to our audience and hopefully more broadly. COVID-19 has been a human tragedy of unprecedented proportions, and it has come upon us with extraordinary speed. And the impact will be with us for many, many years. We have explored many aspects of COVID-19 over the last 7 weeks, and tonight we want to drill into the more local situation, the more local issues, and the more local future. Tonight we have, as Selena explained, two experts that I believe are both extremely well positioned to help us understand the COVID-19 crisis in Houston. As she explained, Dr. Shah has deep and serious experience in our medical community here in Houston, one of the best in the world without question. And Marvin Odom, a distinguished business leader who led us through Harvey as the Harvey Recovery Czar and has now been appointed by Mayor Turner to do the same as the Houston Recovery Czar for COVID-19. So thank you both for joining me tonight, gentlemen. We're honored to have you with us.
Thanks, Marty. Good to be here.
Thanks for having us.
Great. Gentlemen, over the next 45 minutes, we're going to cover this very complex topic, hopefully, from 4 perspectives I'd like to talk about. First, I just want to spend a few minutes and we're going to talk a bit about the present COVID situation locally. Then I want to understand reopening. We're going to talk about reopening in Texas, but of course, we're more interested in what reopening has meant here so far, here in Houston, and what are our objectives in this reopening process. Then after that, what I'd like to do is to kind of expand that idea of reopening. What is a new normalcy going to be like as we continue to hopefully return to that normalcy, whatever that may be. And then finally, I'd like to try to examine what the lasting impact will be on our globe, and of course, importantly, on our community from an economic perspective, our medical industry, the citizens of our community, and any other topics that may be relevant, because this will clearly have a very long-term impact on Houston and the surrounding areas. So let me begin. I want to set the stage, and I know we have a lot of people. If you're listening, I'm sure you're very engaged in the topic, so I'm not going to tell you anything you don't know, but just recently, the number of cases in the world crossed 5 million. We just crossed today 330,000 deaths across the world. The United States, of course, has gone over 1.5 million cases with almost nearly 94,000 deaths. And I remind you, in China, at least the numbers that we got, they never got to 90,000 cases. So we now have more deaths in the United States than they had cases in China. The situation in Texas is there are approximately 52,000 cases in the state. There have been 1,140 deaths as of today. Interestingly, 30,000 people have recovered, which means there are about 20,000 people that are active cases. We've done nearly 800,000 tests across the state, and we're running at about 1,000 to 12 or 1,300 new cases a day in Texas, although that peaked last week at around 1,800 cases. In Greater Houston, which is a multiple county surrounding that is, I think, the main measure, I think that's right, Dr. Shah, we have 15,551 cases, the last number I got, 385 deaths. But interestingly, just like in Texas, a third of the people or more have actually recovered. 6,100 people have recovered, and then there are about 9,000 cases still active. We're doing something, and Dr. Shah will talk, we're doing thousands of tests a day, but there's more to do, and we're going to talk about that quite a bit. Yesterday, there were 385 new cases in Houston. Gentlemen, as you look at that just series of statistics, I'd love to just get your reaction. I mean, they're daunting. I just think 4 months ago, we never heard of this thing. And now we're talking about millions of people impacted and hundreds of thousands of dead. I'd just love to get your initial reactions for that status quo. Maybe, Marvin, you might start, and then I'd like to have Dr. Shah comment.
Well, I think the overwhelming response has to be just the breadth of impact that this has had. So, I think once you get into this, you get very focused on what that curve looks like, and you can get to a position now of actually seeing where we've plateaued on most of those measures and get I say this in a very qualified sense, a little more comfortable with the situation in terms of now it feels like it's being managed. So that's a good feeling. But and that's really, I'd say, from a medical point of view. But the big takeaway for me is this has been such an enormous economic disaster as well that we as people helping policymakers and helping decision makers have to set that up for making the right decisions on the medical side and very much having to make the right decisions on the economic side together. That those have to move in tandem.
Dr. Shah, your thoughts?
Yeah, first of all, thank you, Marty, for hosting, moderating us, and Selena for always the partnership with the Asia Society. I know Marvin and I both have a tremendous amount of respect for the Asia Society and what you all bring to our community. So I wanted to thank you for having us. I would echo what Marvin said, and I would just add the word sobering. I think as we hear the litany of statistics and numbers, it's overwhelming. I mean, when we look across the globe, there is not one country that has not been touched. Every community we know in our country has been in some ways affected, whether it's watching something on TV or in the media, or if it's because you have a neighbor or someone in your family who has been diagnosed with COVID-19. So I think sobering is the word that comes to mind. And the other piece that I would just remind everybody is that all of these statistics can very easily bleed into each other, but we have to remember that every one of those numbers represents a person, and a person with a life, an ecosystem around them, a family that loves them. And I think we just have to keep that in mind as well.
I mean, that's such an important reminder that we tend to look at these numbers in macro sense, but everyone who passes, sadly, is someone's mother or brother or father or son or something, and it's just impossible to measure that. And what we know is that over 40% of the people who have passed are over the age of 80. And to lose a grandparent or great-grandparent or great-great-grandparent in this manner, while they were eventually going to pass, to lose it in this manner is such a sad thing, because in most cases they die in a solitary situation, which is very sad. So you're absolutely right. When you bring it down to the individual and personal level, that's why it is such a human tragedy. I'm going to quote a couple other statistics, though, that are not unimportant. Today, we just got another unemployment number. There are 38 million people who have applied for unemployment insurance in the last less than 2 months, meaning there are something like 42 million people in the United States out of work. We had one of the lowest unemployment rates ever in the month of February at 3.5%, and we will probably peak at 25% or maybe higher in the next reading. And each of the one of those, frankly, are individuals as well. And they are all in their own set of circumstances. In Texas, the unemployment rate's exceeded now 2 million people. And here in Houston, there are 300,000 people, which is about 10 times the normal unemployment rate here in Houston. And so those numbers are, again, locally, they're sad. And of course, we've had this double storm in Texas, and certainly it's hit us hard in Houston because of the damage to the oil industry done by recent price movements. So if it hadn't been for COVID, we would have unemployment anyways. But now combining that with the COVID, it's been quite a tragedy. So this is a bit of this debate is always going to be broken down into the human tragedy on both sides, the 40 plus million people that are now out of jobs, alongside of the many, many people that have suffered from this disease in so many ways. Any thoughts about those statistics before we get into the next phase of our conversation?
Marty, if you don't mind, maybe I'll just throw another couple of numbers at you, because I was having a conversation with Bob Harvey this morning that I'm sure everybody here knows. And he shared some numbers that I thought were quite interesting. So from a Houston perspective, we're about a $1.5 billion a day economy. And there's about $500 million a day that basically goes into payroll. And let's just say we have a 10% unemployment rate in the city of Houston right now, which is pretty close to your numbers. So that's $50 million a day, missing just out of that normal stream going to people to support their lives and to support the economy. And what's interesting to me is when you look at all the government programs, these massive, unprecedented federal programs, as well as everything the county can do and the city can do, it doesn't come anywhere near, trying to replace $50 million a day just on the payroll piece. So I think the important implication is we have to find a way to manage the virus and the economy at the same time, because the only thing that's going to fix this bigger picture is actually starting to bring that engine back up and running.
Yeah, and the only other thing I would add to that is that it's not just the economic engine of the community, it's also in the healthcare system. There has been devastating impact in the healthcare system, hospitals across the country, and certainly really even in outpatient centers and providers who have usually provide provision of care. Now everything has been focused on COVID-19, and that obviously has other impacts as well to the individuals who seek that care, but also to the ones that provide that care. So I think it's really, as Marvin very nicely pointed out, it's an economic piece, but there is also an economic aspect of the healthcare piece, which has also not been as appreciated, I think, as we really need to obviously recognize.
No, and I think particularly here in Houston, where the medical center is so important to our local economy, that may not be true in every other urban center, but certainly it is to us here because we're uniquely positioned with the world's largest medical center and hospitals that are normally full and bustling and solving health issues of people completely unrelated to this are unable to get that help in the same way they would. And the healthcare providers are doing other things. And it's a sad thing. We're going to get to reopening, but one of the questions I keep asking myself, if you were to turn on the TV, and it depends on which channels you might want to watch, you almost believe that this is a binary question. It's either Dr. Fauci versus Wall Street, and that's not the way we want to position this, right? I mean, it is not a binary question. It's not you don't do this and you don't do that. You don't protect the economy, or you don't just and throw the people out, or the other way around. So one of the issues of reopening has been: is it too fast? Is it too slow? How do you do it? And all these, but I think the question shouldn't be, should it be this or should it be that? It's the question is, how do you balance the combination of caring and solving the problem of the disease while at the same time doing the best you can to solve the economic issues that it's caused? So on May 1st, Governor Abbott opened phase 1 of our reopening process. Phase 2 actually came this week, where new offices and other facilities were starting to open. And as I understand it, Texas is following 5 different metrics or benchmarks: reduction in new cases, ability to treat patients in your hospitals, capacity to test people with symptoms, having sufficient contact tracers, who we want to talk about, contact tracers, and then the mortality rate. Are those the right 5 measures? And I know that they're complex ones, but what are the things that we should be watching here as reopening starts here with us? And Dr. Shah, I'm going to start with you on this one because you're the one that's most impacted through your hospital system.
Yeah, I think that the big question is really what are those measures, and I think you're right that those are 5 metrics that have been monitored at the state level. We have our own measures that are at the local level, and Marvin is well aware that we're monitoring with SETRAC, the Southeast Texas Regional Advisory Council. We're watching their measures, SETRAC, as well as TMC, Texas Medical Center, which gives us a view of hospitalizations and utilization of beds and ICUs and ICU beds as well as ventilators. The hard part about this is that, I don't want to go into the woulda, coulda, shoulda related to testing, but I think the hard part of this is that testing has been a challenge in this country. And because it's been a challenge, that number is really the number of people that test positive gives you a breadth. It gives you an idea of the amount of transmission that's occurring in the community. But the hospitalization number really gives you the depth. It gives you how sick people are that they actually have to seek care. When we know the vast majority of people that get COVID-19 actually have very mild symptoms, but there is that significant component that can overrun a healthcare system. So the reason the breadth is so important is that it actually tells us how much transmission is there. But because testing constraints have been an issue, and testing has been not as available as we would have liked early on, especially it's gotten better, is that it really makes it hard for us to judge the number of positives in a community. While that's what we watch, that's actually a very difficult number to actually put everything on. So then in a perfect world, that would be great, but we don't have a perfect world. So then we're having to bring in 4 or 5 or 6 or 7 or 8 different measures and now put those together. The most constant that obviously I think all of us have to keep track of are the number of deaths, because that ultimately is what we're trying to prevent. We're trying to prevent people from dying of COVID-19. That's my job as a doctor. It's my job as a public health practitioner, as a leader of a health system, is preventing deaths. Unfortunately, that is a number that is a late figure, that you will, but it's also a very important one. And fortunately, in our community, we've actually done well. But I will remind everybody, even one death is too many. And so we just have to keep all that in mind.
Yeah, and one of the things, if I think about it as an investor, one of the things we think about is that testing is kind of a leading indicator and deaths are a lagging indicator. And of course, you want to minimize the lagging indicator, but you have to do it through better leading indicators, which in this case is more testing. Theoretically, at least the numbers show, we've done 795,000 tests in Texas and only 52,000 cases actually reported, which means 740,000 people were tested and didn't have the disease. Is that what that means?
It does. We have to be a little careful. As you've heard recently, the state has added in antibody testing to some of their numbers. That's the only caveat I would put in there. PCR testing, diagnostic testing is the way to go. Antibody testing just tells you that somebody may have been exposed, their immune system may have actually ramped up, but it doesn't always tell you specifically what you're looking for, like the PCR test, which actually tests the virus itself. So I think there's a little bit of a grain of salt, but I think in general, the point is absolutely right, which is that the testing has gotten better in Texas, and we have to continue to make sure that we make it available to as many people as possible, while we're also targeting certain groups, because we know that there may be higher transmission or higher risk of complications in those groups.
Yeah, but of course, while we've done 800,000 tests, it sounds like a lot. We're still 41st in the order of states on a test per 100,000 people, or whatever the numbers are. Marvin, what do you think? What do you think about this point?
Let me just add something quickly to what Dr. Shah said, because I agree completely about that set of leading and lagging indicators and the importance. And I'm still trying to formulate the words here, but there's something on the order of strategic monitoring as well, so that we can catch things as early as possible. And it's taking those measures and then it's starting to overlay elements like actually understanding across our population where do the most vulnerable live, and making sure that we're directing our leading indicators, such as the testing and that sort of thing, to those areas so that we're catching it as early as possible. We're applying the contact tracers there, and we're actually trying to impact even those leading measures by just doing it smarter.
So it's a great point. And we have this thing called contact tracing, which we're starting to do, I guess. Somebody needs to help me understand what that actually means.
Does that mean I should turn that one over to Marvin?
Go.
Well, contact tracing it's gotten a lot of buzz lately as response to COVID-19. Marvin and I have talked about this before, that this is a tried and true measure that public health has used across the globe in global settings, domestic settings, and really for TB, cholera, all sorts of other diseases. It's a tool that we've used over the decades, and contact tracing is key as a measure because we don't have a vaccine, because we don't have medications that are therapeutic. So what it does is that it gives us a very good chance now in this phase to actually do what I've said from at least the beginning, which has been catching up on the testing. So you can't trace without a case, is what I've really want to make sure that people know. Foundation is testing, but tracing means that when you test somebody positive, they have been around a number of contacts. You are now going to contact those contacts of the case, and you're going to try to do two things. One, I call it the ABCs. One, you're going to raise the awareness of, hey, you've been exposed potentially. But number two is you're going to actually try to enact behavior change, the BC part, which means if you're symptomatic, I want you to stay away from others. I want you to isolate. I want you to quarantine. But I also want you to go get tested to see if you also are positive. Now that starts the loop again, if they test positive, to go with more contact tracers and contact tracing.
Okay, Marvin, your turn.
Well, there's no way I'm going to try to top that description. So good.
Is it clear? Is it clear? Let me just continue on that point though. Is it clear that if you are a contact of someone who has tested positive, that you will be able to get a test? Because up to now, the only people who have been able to get tests are people that have symptoms. And in fact, you've had to go through this whole process of explaining how deep your symptoms were before you could actually get a test. So are we changing the testing model to say, okay, you met John at a party and John was tested positive, you now can get a test?
So the answer is yes. And I know Dr. Shaw will have his own version of this story and for the county, but in the city of Houston, we announced, I think about a week ago, that we were going to expand the number of testing sites around the city by 24 or 25 sites. I mean, quite an expansion from several large sites to a number of dispersed sites to make it more accessible. What I can tell you, Marty, is those tests are free, and you don't even have to be symptomatic to come get one. You don't have to get approval to come get one. Anyone can actually come get that test. And I think as Dr. Shaw said early on, as long as we can make sure the supply chain can keep up with that, then that's the plan, is to keep it that way going forward. And I just wanted to say one other thing about as we're talking about, I like the way Dr. Shaw described it. Testing's at the top, then you have contact tracing. One of the things I've learned coming into this as an amateur is the toolkit's actually pretty small to manage this disease. And well, the good news is it's very clear, but it's very small. It's testing, contact tracing, and it's individual behavior. It's how we get out there and interact with each other. And those are the three tools that we have to basically live with this disease until we have a vaccine, and to allow the rest of life as we know it to take place.
So yeah, and I would just add the additional piece, and Judge Hidalgo with the county, she's been very much about making sure to support public health, and I think that from the county side that has been so actually energizing, because we have been trying to do everything we can to support the public health activities, because this is not a healthcare problem, and it leads to a healthcare problem when people get hospitalized, but it's a public health crisis. And the Mayor Turner as well on the city side, Dr. Peirce at the city as the city health authority. And I will say that we have been so fortunate to have not just elected officials, but public health officials that have been working very closely together. And as a community, we have fought this virus to date very well. We have to acknowledge that, but we cannot have hubris and we cannot believe that we've got it all figured out. This is such a squirrely virus. This is such we don't know what's going to be lurking around the next corner. And I always answer this by it's a tale of two cities. We've gotten better on testing or tracing. We have 300 contact tracers that are coming on board at our department, better than where we have been. But if tomorrow 4.7 million people said, I want to get tested today, the answer is we do not have that capacity. So I think it's really a tale of two cities, that we're better than where we are, but not still where we need to be.
Is that a financial issue? Is it a just test kits issue? Why do we say we can't do 3.7? And I know we can't, but I'm just asking where that bottleneck is.
Yeah, it's an all of the above issue, right? I mean, right now, even if when you did the numbers for Texas, I mean, obviously we don't even have that throughout the state. I think it's a real supply chain issue. It's about getting the right technologies up, et cetera. But it's also really making sure, as Marvin said, that it's not just about come one, come all. It's actually now testing in a more strategic manner, trying to get to places. That's why our focus is very much not just the general public, but it's nursing homes and it's shelters, congregate care settings, where we're very concerned about the population there, not just because there's risk of spread, but there's also risk of complications.
But Marty, I'd say too, just building on Dr. Shaw, is that the supply chain has to be pushed, right? So if I want to expand into 25 more sites, and I think I may run into a barrier at 20, that doesn't mean I'm not going to shoot for 25, because you have to keep continually push that supply chain to supply more, to supply the right materials, et cetera. And that's part of the plan here.
Yeah. So we are now exactly 3 weeks from phase 1, and the governor felt that we had met whatever test he said. Whether we had or not is going to be debated. And we're 3 weeks out, and now we're into phase 2 of reopening. From both of your perspectives, locally, are we doing are we bending the curve? That was the phrase we all used over the first few weeks of this. Are we bending the curve? Are we getting to a point where the new cases are under control, whatever that means? And I don't want to suggest it under control. You have direct control of it, but these are important questions.
Well, let me start, and I'll turn it over to Marvin. We have flattened the curve. Again, as I said earlier, that we've been successful as a community. All of us as a community have come together, and we've been able to fight this virus. This reopening is really a balancing act, right? It's gotten into this either or, and almost politicized, and really taken both economics and health together, and sort of taken them in a way that it almost seems like they're opposed to each other. And I think what we have to do is really think about the fact that whoa. Oh my gosh, I got the 3-year-old just walked in. Apologies. And now he knows there's other people on. Now he's gone, so he's smart.
Dr. Shaw, does he have a mask on? Can I see? Does he have a mask?
That's right. It's really the fact that we can't pit both of these against each other. We have to reopen because we have an incredible socioeconomic impact of not reopening over time. We have to reopen, but you also can reopen with health lens and safety in mind. You can do both. It's not an either or, it's an and we have to recognize that. And so if you're going, if an establishment is opening, it can reopen, but also take into account, how is it going to protect its customers and its workers? And if you're a customer or you're going into a business and you've got 2 businesses, one's following health protocols, one's not, you have a right to make a decision to say, I'm going to go to the one that's actually following those health protocols. That's how we fight this virus. That's how we continue to make sure that as we reopen, we don't see this upsurge in cases or what's happening in the hospital system.
I don't have a couple of points from a layman's point of view, but my assessment at this point would be that so we're 20 something days into the opening. About the time you'd expect to start to see something, we actually have seen on a 7-day average kind of measure, we have seen a bit of an uptick, but it still looks like it's on a plateau, if you know what I mean. So yeah, maybe we're seeing some response, a little too early to tell, still being managed. All these indicators and measures we talked about before, they all look like they're still, reasonably okay. We're still managing the situation. So we're going to have to watch it very carefully. I do want to express the same concern about this next stage, because I think everybody just feels a little too relaxed about the whole thing. And this individual behavior is just so critical. I was reading somebody sent me an editorial from, I think it was the Wall Street Journal, that had a great way of putting it. We're talking about mask in this case as one element of individual behavior. And they said, wearing a mask is a sign of respect, and it's a sign of supporting the economy, which I think is exactly right. And so we have to change the dynamics around how some of these individual behavior things are looked at.
Well, as some people know, I spent with my family 28 years in Asia, so a mask is not unusual at all to anybody who's lived in Asia. Hong Kong has as of yesterday, 1,063 cases. They haven't had a new domestic case in weeks. They're importing cases, unfortunately, from people coming into Hong Kong. But everybody understands the need to wear a mask. And it is, in fact, a matter of respect for your fellow citizen. It's not just to save you. Most people wear them when they have colds under normal circumstances so that they don't affect others. We have a couple of questions that are coming in. And the question is, one of the questions Pranav asks, for example, to what extent can the government or should the government restrict citizens who refuse to wear masks? And I mean, that's a public policy issue, very hard to enforce, but one that I think we all ought to get our hands around, because people need to feel comfortable that they can call somebody out when they don't have a mask on. Shouldn't we get to that point?
Well, I think early on, or just a couple weeks ago, maybe, it feels like early on, but a few weeks ago, as you know, the county was moving forward in this direction, and the governor, by adding the state level orders, essentially took that authority away. And I think it gets to a broader question or comment, which is around anytime the federal system in response, and I mean elected plus health, or the state system in response, or the local system in response, and all three levels are not on the same page, or are inconsistent, or don't really sing from the same hymn book, it really does what exactly Marvin said, is that it leads to, one, confusion at the community level by a community member, and number two, it leads to complacency. So I would really hope that it's not about requiring somebody or forcing somebody, but from a public health standpoint, we want people to understand why it's so important to wear facial coverings, why it's so important to social or physically distance, because ultimately that's what we have to rely on is individual behaviors, and people really want to do the right thing to not just protect themselves, their loved ones, but the community at large.
Yeah, I want to go back for a second to the economic side of this. There's going to be a mental health issue out of this. This is getting some attention now, I think, and it's going to be more serious. I'm involved with the United Way, as you all may be, and they have a wonderful 211 line where people in distress can call, and the calls to the 211 line are up 73% during this crisis. And these are people that are calling out for help, whether or not it's economic help, whether it's personal needs or whatever. And I think one of the things that won't show its head right now, but we should talk about for the future, is the rest of the people left behind, either the unemployed, all the people that are unemployed or underemployed or are somehow struggling personally. There are going to be other issues, don't you think?
Yeah, I don't think there's any question, Marty. And it goes a little bit to your previous policy question. it's living in the U.S., living in this state, I'm not going to operate under the assumption that I'm ever going to get a policy in place that mandates wearing masks, right? So for me and where we are in space and time, it's more a recognition of saying these are the tools we have. How do we do the best we can within this space? And then it raises the importance of education and motivation from that perspective. But I think your point too, let's put it in the category of those left behind. I think that really does then become the big responsibility of local governments and governments generally, is to look after those portions of the population that are the most vulnerable, both medically and economically and otherwise. And that's where we have to apply, very scarce resources in the short and medium term to help people get through this crisis until you have an economy growing and to an extent, again, that it can help support these people on a broader basis. So I think it's very much the policy that we need to adopt. And we do, frankly, and certainly in Harris County and the city, we do.
That'll become another public health question, I think, as we go forward at some point. So let's talk about the future of reopening. So we're into this already for sure, obviously, right? So now we've been through 3 weeks of it. We've got more indicators now than we had before. We're hopefully going to get more testing. We're going to get the statistics are building as we go forward. And we've now reopened a second time. What are going to be the key indicators, let's say on June 15th or July 1st? Or is there any point in time when we say, hang on, we moved too fast? So far, I guess the indicators are we haven't done that yet, but there's always that risk, right? And again, the trade-off is real. And so how do we think, let's say a month or 6 weeks from now, whether or not we've moved too fast to get where we are?
Well, two things I would say. One is that as you were mentioning the metrics at the state level, the last one you mentioned was a downward turn in the cases, the number of cases that were being diagnosed. That, unfortunately, we have not seen in our community. And that's the plateau that Marvin was talking about. And so that's a concern. And the second piece of this is really that as we continue to move forward, it's almost like a chemistry experiment or equation. When you take 2 hydrogens and an oxygen, you get water, right? But if you take hydrogen, you take nitrogen and carbon and oxygen, and you add them all together, and you got 7 or 8 different things happening all at once, it's hard to know what the reaction is going to be at the very end. And what I mean by that is that as we start with, let's say, restaurants at 25%, then we add in barbershops, nail salons, then you add in, gyms, you then say, okay, tomorrow it's going to be the bars, and now restaurants are going to 50%. And you layer all that along, it's really hard to know what that's really going to mean a few weeks down the road, because you have so many different elements that are being added at the same time in a relatively short period of time. And so honestly, we don't know. And really, it depends on the establishments as well as the individuals following through on those health protocols.
Of course. Go ahead, Marvin.
Well, I think what I'd add to that is we have to be pretty light on our feet as we move forward here, because there is so much that we don't know, and there's so many moving pieces. And I think you'd be interested to hear that a group that gets together here of the medical community, TMC, the business community, including Greater Houston Partnership, the city, the county, we're actually working through a tool and a process now around recognizing and working through different scenarios that could happen over the next couple of months. And then testing everything from policy decisions to other actions that we would take in those cases. And as somebody said it the other day, it's not about the plan you come up with necessarily, it's the planning. It's kind of exercising those muscles of what to look for and then what to do as you start to see a response. And to get a little more specific about that, on Friday, we'll be looking at a case where we're dealing with some level of uptick in those indicators, enough to be concerned about it, along with a hurricane that happens simultaneously. So then what do you do with sheltering people and that type of thing? So that's, I think it's when I watch the bigger community of all these different groups come together and able to really concentrate on a tool like that and develop a product that will truly be helpful for us, it's some of what's happening around here is actually pretty impressive.
Yeah. See, I wonder, because as we progress through this opening, what we're doing, we're basically making a restaurant go from 25 to 50%, get more dangerous. Opening a bar, more dangerous. And we're actually opening in a way which suggests that the number of infected people is going down, which technically it's not, although there are recoveries. But I guess more importantly is we're taking, just by the mere fact that we open beauty salons where we wouldn't do it 2 weeks ago, suggests that, in fact, we're adding a little bit more risk to the system of reopening. But of course, the other side of that is we're putting people back to work, and we're rebuilding an economy that's been devastated. And the question is this, do we want the economy to die? And there is, a lot of economists will debate that with you. So these are very difficult trade-offs. As you suggested earlier, Dr. Shah, this is not an either or, this is a balance, and it's very hard. Let's talk a little bit more about the future as well. One of the things I want to hear from you, Marvin, is you've been talking to a lot of businesses. I work for a big bank. We're not about to open tomorrow. We're not about to open next week. There's still a lot of uncertainty. We don't want to put our employees at risk. What is the conversation in the boardrooms and in the executive suites around our community about them putting their employees back to? They may be getting paid, but they're not in their offices.
Well, I think Dr. Shaw used a term earlier, Tale of Two Cities. I think it's the same on the business side, because I do start to see a separation between some of the larger, medium to larger size businesses that have a lot of capacity and have some financial capacity as well to do certain things. And I'm actually not so worried about those groups finding the right way to go back. And I've reviewed some of those plans for some of those companies. It's actually very impressive what they've come up with. And I'll tell you, they're not rushing back into the office. They're starting with numbers like maybe 15%, and they have all of their measures in place and indicators. They have people with designated roles to make sure behaviors and other things are happening the way they're supposed to happen as reopenings take place. So I'm already seeing, just because it's in their own self-interest, these companies develop, excellent plans for coming back. And I'm not too worried about those. Again, I go to our it's not unlike our conversation about governments and others focusing on those that are more vulnerable. In this case, just have less capacity in terms of smaller businesses. So I think there's a combined role of more focus on that, from everything from education to actually supplying PPE to these companies, but also it's in concert with big business helping smaller business. And I think if you look at what's happening inside a group like the GHP, you see a lot of that starting to happen. So I'm pretty optimistic on the medium and large size, not particularly worried about those groups. A lot of concern for the very small businesses. And I'll try to put that policy comment into effect. One of the things we worry about are those very small businesses in the more disadvantaged communities, because while they could disappear and they're not going to make a big impact on the Houston economy, they make a very big difference to that neighborhood and people's well-being in that neighborhood. So us applying resources to help those businesses survive is extremely important, and having that clarity on priorities is important.
That's a great perspective. So I want to talk about a topic that's getting more and more attention today, and that's the second wave. And if there is anything that's been politicized out there, it's the second wave. I was reading an article yesterday that said that 90% of Democrats believe that there will be a second wave, and 90% of those believe it will be Trump's fault. Some much lower percentage of Republicans don't believe there'll be a second wave, and they believe it'll be somebody else's fault. That's all nonsense at the end of the day. What I want to understand, maybe Dr. Shah, you can help with this. What do we mean by a second wave? Is this really a weather-related thing? Is it a humidity thing? Is it just what is a second wave when we start to talk about that? It's not cases growing because we're reopening. That's a different issue, I think. A second wave is something unrelated to what we're doing right now. It's something that I think we expect, but we don't know. I don't understand how it might happen.
So let's maybe take a step back, and not to go into too much of the science of it, but COVID-19 is a part of a family of coronaviruses, right? Causes common cold, typically very mild symptoms. Every so often, it takes unfortunately a turn for the worse. We saw it with SARS 2003 and Middle East Respiratory Syndrome MERS in 2013, and obviously COVID-19 here. A mutation from animals to humans, and boom, there you go, person-person spread, and we don't have immunity to this. And I think that's been the real challenge, is that what we're trying to do is to, at the same time, make this a situation that allows us to be as nimble as Marvin said. But I think that the key issue is that the family of coronaviruses over time, usually there is a seasonal variation, that in the summer you don't see as much of the common cold. And so there is a seasonal variation. But when you have a novel virus, unfortunately, and this is with SARS way back, is that you don't know if it's going to have a transmission decline in the summer, which is obviously what our president said, but we don't know if that's going to happen. So the concern for the second wave is that maybe because of the family of coronaviruses, you have a decrease over the summer, but now it comes back with a vengeance in the fall, right at the same time as people are at home, indoors more, connected, collected together, and you have flu season. And now you have an increase all at once. That's the concern, a second wave, really. That's what we're referring to.
I guess we're supposed to be certainly aware of that, if not scared by it in some degree. But what you're suggesting is really nothing we can do about it. If it does happen in the physical world, we're just going to have to be able to deal with it at that time.
Unfortunately, I do think the vaccine issue comes up, and obviously the president has said that his goal is to get a vaccine by the end of this calendar year. Dr. Fauci and others have said that the best we're looking at is 12 to 18 months from April, which now gets you into April or even into potentially 2022. So that really now starts to sort of lead us to what Marvin and I have talked about previously, is that, again, until you have a therapeutic, you're kind of ping-ponging your way all the way to that point where you have a true definitive care for this. And in the meantime, you have to do all the public health measures. That's our only set of tools.
So we're getting closer to the end of our time together. I got one more question, then we're going to go to our questions from the audience. And I want to talk about the long-term implications of COVID-19 on the United States and here in Houston. After Harvey, we knew the things we needed to do. We needed to reduce the threat of flooding. We needed to take care of our underprivileged communities who were grossly disadvantaged by the impact of Harvey. Are we going to be prepared? And maybe this is both a medical and a community question. Are we going to be better prepared for the future, maybe the second wave, but even beyond that, the future pandemic of this nature? Are we going to do you hope and think we'll be better prepared?
Well, I'll give you a start on that, Mayor, if that's okay with you.
Sure.
I think there's a couple of things I think about. So let's just use this one as the example, but for the long-term piece. Now, in the time when there's a vaccine available, I think that what we have to do, and I do think it helps us in the long run, Marty, is we have to develop what I'd call a safety culture. So I'm a product of my my career and a lot of other things. But working in the energy business, you work for decades on developing a true safety culture inside a company, because there are real risks. Individuals are not great at assessing those risks sometimes. And so, just to try to make that real for this scenario, the way I think of a simple safety culture on the front end here is when I walk into a room, and I do this now, I don't stay in my house all the time. When I walk into a room, I assume that there's somebody there that's asymptomatic. And I just demand that I act accordingly to protect myself and to protect everybody that I love. And that's a way of thinking about this that changes people's behavior. And I think we need some long-term behavior change. The other thing I think that will help us be better prepared, I put in the resilience category. And there's a stronger resilience culture building up, I think, in the county and in the city. And I'll use this whole idea of digital equity as an example. So, you've got kids that can't go to school right now. There's issues around learning and access to digital access to school opportunities and so forth. Some of that, we're going to find a way to address some of that as part of this. But in a long-term sense, that will make us much more resilient next time we have to shelter in place or do something to that extent, because that capability will be there. So that's just one example, but I think there are many more in that category.
Yeah, and Marvin, I think he hit the this point in a couple of different very important way, which is that resilience at the end of the day, what this is about. We have to be resilient as an individual. We also have to be resilient as a community. And I think both of those really matter. And as you think about it, where we are today versus where we were, 2 or 3 or 4 months ago, decisions that we didn't really know what the road ahead was. It's still fuzzy in many ways, but in so many ways, we have a better understanding of what we're dealing with. We certainly don't have it all figured out, but it really does rely on the resilience of individuals and their behaviors that really allow them to be more resilient, as well as the communities that we're building that certainly need to also be resilient in kind, and those policy decisions. One thing that we have to remember is that, for example, there have been health inequities or health disparities that have been highlighted with certain populations in our communities across the country that have been more affected, whether a number of cases or number of deaths and adverse outcomes. We have to remember that COVID-19 didn't cause all these disparities. They've only accentuated those differences that had been pre-existing for all these years or decades. And that's why I think resilience is really a commitment by all of us to really do better and to do whatever we can to really help our community get through this together, and obviously in the most resilient way possible as we head to the future.
That's fantastic. I'm going to stop my questions now and go to the audience. I think maybe the first one that's come by Paula, which I think is relevant to our most recent commentary here, is how will the reopening after affect PPE supplies and other critical elements of the medical center and your hospitals, Dr. Shah? There is a concern right now. As I understand it, we're in good shape. We have enough hospital beds. We have enough ICU beds. We have enough ventilators. But if there was a spike, how do you feel about the supplies that you have to be able to put in your position to serve the community?
Yeah, and I think that's a great question. I think that's really the concern, is that as Marvin mentioned, the uptick or the increase, that increase then really leads to individuals that are going to the healthcare system. You cannot replenish the supplies quickly enough, whether it's gloves or masks or ventilators, et cetera. And you have limited supply chain constraints that really, at the end of the day, what it does is that it actually puts individuals then at risk. And that's why we have to do everything we can not to get there where the supplies are so limited that we can't take care of people. It's up to all of us. So the answer is we don't know, but it's really dependent on how many of us follow these directives or guidance or recommendations or protocols, and how many then, unfortunately, hopefully we don't get the transmission such that people have to go to the hospital and then use up those supplies.
Mm-hmm. Marty, I think if I could just add, because I think this is where I try to add something as a non-expert in the room, right? So I think we can all see that you listen to Dr. Shah's answer, makes perfect sense. But you have to take it that one step further, and I know he does, which is, okay, we have to work through some of these scenarios, and we have to make a decision on how much PPE do we need in reserve to feel pretty comfortable that we can manage what could be coming in the future. So it's about making those explicit calls. Won't be 100% right, but those decisions have to be made.
Right. So 2 people have asked this question related. Thomas and Jenny have both asked about the opening of schools. Colleges, local schools. I mean, right now we're facing some dates, some deadlines that we have to start making, I presume, some decisions. Everybody says, well, wait, but these are going to be tough decisions. And somebody's going to have to make them. They'll either make them at the school level. HISD's got over 200,000 students. Somebody's going to have to make that decision. How do we look at those decisions, and when do you think we'll be able to make them?
Well, you saw the 3-year-old, my 6-year-old. He just had his kindergarten graduation today virtually. So I'll tell you, we're proud parents of a kindergarten student who's now made the next level. I'll tell you, this is on the minds of a lot of not just parents and educators, but obviously policymakers. And the truth is that we're also moving into the summer where there's summer school, there's camps, there are all sorts of other activities. I'm actually feeling that if we continue in the way that we are, that you will have either one of two pathways. One is going to be a virtual pathway. The other pathway is going to be socially distanced and a limited, whether it's a 25% or whatever level that is. Those are the kinds of things that we are going to be looking at because we are certainly very concerned about kids, especially the younger kids, because now this Kawasaki disease, which is now impacting children, and we want to make sure that we're also protecting kids as well as we continue to move forward.
Yeah, and that has a real impact on employers, of course, because schools are the best daycare centers that we have. And it's a real challenge for employees who have children and aren't having them in school. And, the last 3 weeks, 6 weeks, 8 weeks have really proven that, not just with 3 and 6-year-olds, but obviously olders as well. Were you going to say something, Marvin, on that point?
Well, only in support of that. I just think my commentary was going to be, as Dr. Shaw said, they're working all these permutations on what coming back looks like if you're trying to enforce more distancing, and those are huge challenges, but they're working it. I think in positions like Dr. Shaw's and what I'm trying to do to help the city is we better push this digital option pretty hard as well.
Yeah.
To the virtual option, because we may need it, and if we don't need it now, we'll need it sometime. So it's important.
That may be the new normal, and I think it kind of worked, but I think there's both an issue at the student level, but there's also an issue at the professor or teacher level, getting comfortable with that digital option.
Right. Sure, and so many people, from an equity standpoint, so many people that just flat don't have access. Yeah.
So, and the transformation of our society. I think all of us know that how society is transformed for this, this digital, electronic, virtual way. We never would have thought that Asian society would have this, and the three of us would be having this conversation. People are watching, and just the way this has really transformed for the worse and also for the betterment in many ways, advanced so many different ways of how we see life and how we have those daily activities.
No, I don't think I've talked to a single company, Marty, that's not saying that, I guess it was who said it I can't remember. Somebody said, we want you all to come back never. You can always work virtually from now on.
I tell you, from a very personal perspective, I'm ready to get back to the office. I need some sleep.
I haven't talked to a single company that's not thinking, there's a portion of our workforce that we may just go virtual from here on.
Randy asked, I think, an important question, and a little bit we didn't get to it before, but the protocol. If we do get a spike or we get a second wave, either one, what we've seen is the federal government has devolved the responsibility for the opening process to the states, and the states, I guess, have legal precedent over the local situations. But let's look at Texas. El Paso County was not allowed to open in the second wave because they had not passed these tests. And so Governor Abbott said, nope, El Paso County is left out. And frankly, your colleague Tony told us why, because nobody in El Paso will wear a mask, evidently. I don't know. But what's interesting here is that if we do get to the second wave, who's going to make that decision that we need to maybe close back up again or take different measures?
Well, I'll throw this out there, and it's a completely novel, shocking idea, but I hope it's public health and health that makes that decision, and at least driving those metrics that we start to say it's health and safety that really is what we're trying to balance with all the decisions to reopen. I'm coming from a health perspective. That's what I'm going to say. I'm going to turn it over to Marvin because I know he's going to then balance what I'm saying because obviously it is complicated. It has to be a balanced equation.
Yeah, I think here's my response is pretty simple. Reversal is a pretty high bar, and I think we should just all know and recognize that. clearly has to be informed and driven by the medical community. But I see it as ideally, and I think realistically, as a local and state decision. I don't think we'll make it without each other, and we'll just have to continue to improve the way that decision making is done between the local groups or local governments and the state. But I don't look to the federal government to make that call for us here in Texas.
Yeah.
And maybe last question I have for you, Dr. Shah, is that there have been drug companies, who've been trying to come up with some therapeutic drugs to ease the damage of the disease on people who have contracted it, and particularly those in the later stage in a very serious condition. Do you have any present information on what's going on in that space today?
Yeah, I mean, there, as you've seen, that there have been a lot of touting of medications that can do certain things. Even the antiviral that's been touted of recent. We have to just remind people that these are not cures. They're designed to decrease the amount of time that somebody is impacted. I think it's 14 or 15 days in a hospitalization versus 11 days. It doesn't get rid of the virus. What it does is decreases the duration. So there are a lot of these therapeutics, and even obviously the vaccine development that's in the works. What I just want to say is that this is right now, I would venture to guess, the most studied virus in the world. This is the most studied virus in the world. And what that means is that every day, when it would take a week for you to get information, we're getting that information on a daily basis. That's why you're getting a compression of an onslaught, a wave of scientific information, because so many people are working on this, because it's a global problem. And we're going to come up with global solutions. That's the only way we're going to be able to get out of this. Right now, there are promising pathways in both therapeutics and vaccines, but none have panned out yet. And so obviously all of us are optimistically hopeful.
Well, I want to thank you both. We've passed our 1 hour. It flew by pretty quickly. There are other questions in the chat box, but unfortunately we don't have time to take them. In the meantime, what I want to do is to thank you, Marvin, and thank you, Dr. Shah, for joining us this evening. It's been an exceptionally informative session, one that I hope gave our audience a sense of what we're doing here in Houston and what we need to look forward to, and the signs we need to watch as the weeks pass by. For our audience, we want to thank you as well. We're very proud to have you with us. As Selena said, this was our 8th week. We're going to continue. The Asia Society Texas Center is committed to continuing to inform our community. Please tune in again next Thursday at 7:30, same time, for the Asia Society's weekly COVID-19 webcast. The topic is going to be the global race to develop vaccines and treatments for COVID-19. I think, as we know, it quite often takes 5 to 10 years and billions of dollars for a vaccine to reach the final approval stage and enter the market. It's a very hard process and a very expensive process. Experts in the field actively working towards the development of COVID-19. And as Dr. Shah just said, it is the most studied vaccine in the history of mankind. I'm sure that's the case. So our experts next week are going to discuss the challenges and risks associated with developing a vaccine and the most likely timeline for its availability to the public. We hear a lot about that on the news. Stocks have gone up and down based on this. I'm not sure what we can believe, but hopefully next week you'll get some expert opinions on what the real story is. Learn more about upcoming webcasts from the Asia Society website. In the meantime, we wish you all very good evening and a very happy Memorial Day weekend. I want to remind us that Memorial Day reminds us of those who have served our country, and it's a very special weekend for us all. I know many of the celebrations that would normally be coincident with this weekend are not going to be called off, but that doesn't mean we shouldn't still think about and respect those who have served our country. Thank you all, and we'll see you next week.
Thank you, Marty.
Thank you.
Thanks, Dr. Shah.
Thank you, Marvin.